The following is a presentation on healthcare issues by Canyon School District's nursing services. Many students have healthcare conditions that need to be addressed at school. The most common conditions include asthma, life-threatening allergies, diabetes, and seizures. The following videos and slides will give you a brief overview of each of these conditions. The first condition we'll discuss is asthma.
If a student experiences an asthma episode at your school, follow the steps in this guide to ensure a quick and effective response. The steps are separated into 3 color-coded zones, moving from green to yellow to red as the urgency of the situation escalates. Green zone. The green zone is a non-emergency situation when a student does not have asthma symptoms. Take advantage of this time to be prepared and to understand how you can prevent or minimize asthma problems. Know which students have asthma and where they keep their medicine, and be aware of students who may have asthma symptoms. Common symptoms of an asthma episode may include coughing, difficulty breathing, tightness in the chest, shortness of breath, breathing hard and fast, and wheezing, which is a whistling sound while breathing. Symptoms can worsen and lead to severe, even life-threatening asthma attacks. Treating these symptoms promptly can prevent asthma episodes, and it allows the student to resume school activities. Yellow zone. If a student experiences asthma symptoms and needs your assistance, you are now in the yellow zone, and more urgent steps are required. First, quickly evaluate the situation. If the student is struggling to breathe, to talk, to stay awake, has blue lips, or requests an ambulance, call 911. Never leave a student alone. Have an adult accompany the student to the office or send for help. Don't wait. Stop the student's activity. Separate the student from any allergen or irritant if possible. Common asthma allergens and irritants include smoke, pollens, furry animals, or strong odors from cleaning products, paints, or perfumes. Help the student remain calm and in a comfortable, upright sitting position. Locate the student's prescribed quick relief inhaler medicine and help him or her self-administer the medication. These pictures show commonly used quick relief inhalers. Contact the parent or guardian. If the student is still having trouble breathing after 20 minutes, repeat the quick relief inhaler medicine. Red zone. The red zone is an asthma emergency. If any of the following occurs, you should call 911 immediately. If the student struggles to breathe, talk, or stay awake, has blue lips, or asks for an ambulance. If the student does not improve after 2 administrations of quick relief medicine and a nurse, parent, or guardian is unavailable. If quick relief medicine is unavailable, the student's symptoms have not improved spontaneously and a nurse, parent, or guardian is not available. If you are unsure what to do. In any case, do not try to treat severe symptoms yourself, and don't hesitate to call 911. An asthma episode can happen at any time. School personnel can be prepared to respond to asthma attacks by learning the signs and symptoms of asthma and by following this guide. Remember, never leave the student alone, and if in doubt, don't be afraid to call 911.
In a classroom of 30 students, 3 will have asthma, so it's important that you know who those students are and what their triggers are. Common classroom triggers include chalk dust, animals, and strong odors such as perfumes and paint. If you have animals in the classroom, try to choose ones without feathers, fur, or dander. Some students may need to stay indoors during recess if the air quality is bad, so it's important that you communicate with the principal regarding air quality. The next condition is life-threatening allergies.
Hi, I'm Dr. Camargo, an emergency physician and expert in the treatment of allergic reactions. One of the first questions patients with severe allergic reactions usually ask is, what causes anaphylaxis? The most common causes are food and insect stings. But anaphylaxis can also be caused by other things, such as contact with latex, ingestion of medication, or rarely by exercise. The next question many patients ask is, how do I know when it's really time to use my EpiPen autoinjector? My answer is simple. As soon as a person with a history of severe allergic reactions comes in contact with a known or suspected trigger, such as a specific food or insect sting, and he or she begins to develop any symptom of anaphylaxis, EpiPen should be administered immediately. Signs and symptoms of anaphylaxis include skin or lip swelling, itching, hives, trouble breathing, stomach cramps, nausea, vomiting, lightheadedness, dizziness, or fainting from a severe drop in blood pressure. It's critical that you don't hesitate to use your EpiPen, because a severe allergic reaction can turn into a life-threatening emergency in minutes. After the injection, you'll need to call 911 and get to the nearest hospital emergency room as soon as possible, in case further medical treatment is needed. If symptoms of a severe allergic reaction are still present about 10 minutes after the first injection and you haven't received medical attention yet, a second dose of epinephrine may be necessary. Be sure that you always have the EpiPen auto-injector with you, because every second counts during a severe allergic reaction.
Whether you need to use EpiPen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube.
Just flip open the yellow cap,
Or the green cap.
slide it out, and hold it like this.
Blue to the sky.
Orange to the thigh.
Then you take off the blue cap.
Blue safety release.
Never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this.
Boom.
It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove EpiPen.
you'll still see some liquid in there. But don't worry, your EpiPen Junior auto-injector gave you the right dose, and it has a special feature, the Never See needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away. Call us an ambulance.
Or have someone take you to the emergency room. Just make sure to do it immediately.
Oh, hey, I'm Ben. And this is AviQ, the first and only epinephrine auto-injector with voice instructions for adults and children with severe life-threatening allergies. Did you get all that?
Good. Now, in case of an anaphylactic emergency, here's what you do.
First, pull AviQ out of its case.
If you are ready to use, pull off red safety guard. If not ready to use, replace the outer case.
We're ready. Okay, red safety guard, give it a good pull.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
AviQ should only be injected into the middle of the outer thigh. Also, feel free to leave your pants on. AviQ will still work. How will you know it's working? You'll hear a click, then a hiss. The needle will retract on its own.
But remember, do not remove AviQ until the 5-second countdown is done.
5, 4, 3, 2, 1. Injection complete. Seek emergency medical attention.
All staff must receive training from their district nurse before they can administer epinephrine auto-injectors in the school setting. If a parent brings an auto-injector into their classroom, do not take it from them. Have them take it to the office, and the office staff will work with the parent to get the doctor's order and the proper forms in place so school personnel can legally administer the auto-injector. Next is diabetes.
All school staff need some basic knowledge about diabetes. Diabetes is a chronic disease. It cannot be cured, but it can be managed. Diabetes management is 24/7. You have to time and balance your meals, exercise, insulin, or other diabetes medications, and monitor blood glucose levels. Generally, food, stress, illness, or injury can cause blood glucose levels to go up. Insulin and other diabetes medications and physical activity make blood glucose levels go down. Glucose, also known as sugar, gives us energy. Glucose comes from food, especially carbohydrates. It's carried from the blood into cells in the body by a hormone called insulin. People with type 1 diabetes don't make insulin, while people with type 2 diabetes don't make enough insulin. With type 1 diabetes, the immune system is involved. For some reason, the body destroys cells in the pancreas that make insulin. This type of diabetes is called type 1 diabetes. It's the most common type in children and adolescents. The treatment for type 1 diabetes is maintaining blood glucose levels with a balance of food, physical activity, and insulin. Diabetes management is all about keeping blood glucose levels in a safe range. Not too high, but not too low either. This means having access to the necessary tools, like a blood glucose meter, insulin, food, glucagon, and sometimes other diabetes medications, and the school nurse and school diabetes team, which can include teachers, the principal, school secretary, cafeteria workers, and others. Diabetes can be serious in the short term if blood glucose levels become too low. Over the long term, high blood glucose levels can lead to complications like heart disease, stroke, blindness, amputation, and kidney failure. This is why good care is important. While diabetes is serious and does require 24/7 care, there's no need to be frightened or intimidated. The needs of the student can be safely and easily met when the school diabetes team has been properly trained and works together.
Most students with diabetes will have an individualized health management plan developed by the district nurse. This plan will indicate the normal blood glucose range for the student, how to treat low blood glucose, and other care that is required by the student while at school. Students with diabetes will not be able to think clearly and may behave differently if their blood glucose is not in the normal range. If you suspect the student is acting differently, have them check their blood glucose. A low blood glucose is a medical emergency and needs to be treated immediately. A high blood glucose is not considered a medical emergency unless the student has labored breathing, is confused, very weak, or becomes unconscious. If they are unable to check the blood glucose, treat as if the blood glucose is low. If you have questions about a particular student, please contact your district nurse. Next is seizures. Seizures occur when the electrical system of the brain malfunctions. Instead of discharging electrical energy in a controlled manner, the brain cells keep firing. This sudden, uncontrolled episode of excessive electrical activity can cause a person to collapse, convulse, or have another temporary disturbance of normal brain function. Not all seizures result in loss of consciousness. Some seizures may result in a change in the person's sensation, awareness, or behavior. True seizures are involuntary in nature, that is, they cannot be stopped or controlled voluntarily. Seizures can be triggered by a variety of both internal and external stressors. While most triggers can be averted, thus preventing the onset of a seizure, some seizure triggers cannot be avoided. Every individual has different triggers. Prevention measures must be taken seriously. Some seizures, such as absent or petit mal, myoclonic or partial seizures, manifest as brief episodes of staring or spaciness, stiffening, or abnormal behavior. They may also involve blinking, chewing, or various hand movements. These seizures result in an alternation of awareness, consciousness, and memory. However, no first aid is generally required. A gentle reminder of the task at hand or repeating of instructions or questions are generally all that is necessary. First aid is required for atonic and grand mal seizures. Atonic seizures are also known as drop attacks and result in abrupt loss of muscle tone that cause the head to drop and the individual to collapse suddenly. Because of the sudden onset of these seizures, they can result in significant injuries to the head and face. Generalized tonic-clonic or grand mal seizures are the most common type of seizures, and they begin with stiffening of the limbs, the tonic phase, followed by jerking of the limbs and face, the clonic phase. During the tonic phase, breathing may decrease or cease altogether, but typically returns during the clonic phase. These can be life-threatening due to impaired breathing during the seizure. First aid for grand mal seizures includes easing the person to the floor and positioning them on their side. Keep hard, sharp, or hot objects out of the way. Do not attempt to try and stop the seizure by restraining the individual. Do not force anything into their mouth or give them food or fluids. Loosen any restrictive clothing that may impair their breathing, and observe and note the length of the seizure, any skin discoloration, any injury caused by the seizure, or any breathing difficulties. And finally, if the individual has stopped breathing, or if the seizure lasts longer than 5 minutes, call 911 for EMS services. It can be difficult to know what type of seizure a person is experiencing. Regardless of the type, 911 should always be activated in the following situations. If a seizure lasts longer than 5 minutes, if there is no known previous history of seizures, if seizures are clustering and repeating, if the person is having difficulty breathing or not breathing at all, if the seizure results in bleeding or serious injury to the person, or if the individual is known to have diabetes. In all of these situations, 911 should be called. In Canyon School District, the nurses cover multiple schools, but each school has an assigned nurse. Many of the students with health conditions have an individualized health care plan developed by the district nurse. If you have any questions or concerns about a particular student's health condition, please contact your district nurse. To find out who your district nurse is, ask your head secretary, or you can look it up on the Canyons District website under Nursing Services. More in-depth training on these health issues can also be found on the Canyons District Nursing Services website.